Good morning, good afternoon, everyone. My name is Rachel Post, and I am a senior consultant with the Technical Assistance Collaborative. I will be joined today by my colleague, Teresa, who is also with the Technical Assistance Collaborative. You'll get to meet her in just a moment, but first we want to just do some brief housekeeping. So today is the second session of the SNOFO learning community. And we're really happy that folks have joined today. I do want to start off just recognizing that we do have ASL interpretation and transcription happening during this session. And so for live transcription, click live transcript and then select show subtitle. And then the subtitles can be moved within the window and resized. If you're experiencing any technical difficulties, please contact info@hhrctraining.org. And maybe I could ask Alicia to put that email in the chat. I do see that we have a hand raised. Now it looks like that hand may be gone. So raise your hand again if you had a question. I also just want to start with the disclaimer that the Homeless and Housing Resource Center is a program operated by Policy Research, Inc. and developed under this specific grant number from the Substance Abuse Mental Health Services Administration, also referred to affectionately as SAMHSA, the U.S. Department of Health and Human Services, and therefore interviews, policies, and opinions expressed are those of the authors and do not necessarily reflect those of SAMHSA or HHS. Okay, with that, I am going to turn this over to my colleague, Teresa.
Thank you, Rachel. Thanks everyone for joining us today. I'm happy to be here. So today, as Rachel mentioned, we're going to be discussing resource mapping and using resource mapping to maximize the partnerships and coordination of services within your community. We can go to the next slide. Just briefly to recap the last session, this is session 2 of a 4-part learning series. Our first session was about identifying those whole person care needs in your community. We talked a little bit about how to go about that using a variety of different data sources that may or may not be available to you in your community, both quantitative and qualitative, and of course, lifting up as the most important data source, the qualitative information coming from the people you serve, and how to go about collecting that and implementing programmatic change and go about that process in a way that's ethical and kind of honors the needs and wants of the people in your community. So today we're going to shift a little bit like, okay, you've collected that data, you kind of are gathering an understanding of what the needs in your community are and what needs that maybe you're meeting within your organization, but also what's beyond kind of the scope or the capacity of your organization. So how do we then extend our reach through collaborative partnerships so that we can together as partner agencies, as a provider community, better address the whole person care needs of people. And one kind of systematic way to go about that is through resource mapping. So after I talk about kind of what those partnerships might be and about forming those partnerships, Rachel will take it over to talk about the resource mapping process, what it is, why it's necessary and helpful, and how you do it. And then we will have some time at the end for questions and answers. Also, I just wanted to mention one more housekeeping thing. Though you can't come off mute during this webinar, you can drop questions in the chat. And I think there will be several different points throughout this webinar where we are asking you to participate a little bit. So there's some resources we're really going to do a deeper dive into and kind of show you how to navigate getting information. And we may say like, hey, what community you're from. So I would encourage you to have your chat open and please participate as you'd like. It always makes for a better discussion. We can go to the next slide. And so today, when we talk about partnerships, I want to push everyone to think beyond the partnerships you're currently engaged in and think about like what's possible and think about those partnerships that we don't normally consider. So one that I think about from my career, and I guess a little bit of background on that is prior to this, I ran like a homeless services system. So that was shelter and permanent supported housing that was part of a CoC, some outreach, some day drop-ins, some harm reduction services. And I think I learned a lot about what different partnerships look like beyond what I'd probably previously considered and how that could meet people's needs. So one example I always think of is the RMB in Massachusetts where I was. I don't think I ever traditionally would have considered them a partner, but I'm sure you're all familiar with like the resource gathering that happens at the beginning of someone's housing process and how that can be challenging. And we've partnered to get like a special appointment time set aside for folks. And of course, you have to have willing partners to work all of that out. But it really made me think like, wow, what's possible here? Like, who am I not thinking of that could help me meet needs of the people that I'm working with? And so that's just an example of how when we work together to align and leverage our work to coordinate affordable, accessible housing with increased access to health and social services, we can create an infrastructure that really meets people's needs and makes navigating the things that meet their needs possible and not overwhelming and streamlined in a way that just better serves the people that we work with. So with that said, partnerships just don't happen. And I love this quote, they need connective tissue. So our agencies are going to evolve over time. The way services are delivered are going to evolve over time. Community needs are going to evolve over time. So it's, not really enough to have that one-off referral. We really want to create meaningful and formalized partnerships that can kind of stand the test of change. And so that we can evolve together as a system as the needs of people in our system evolve. We can go to the next slide. Okay, so this slide is more of an overview, but we have a poll in the next slide. So I want people to start thinking about the partnerships that you might engage with. We will later on in the presentation kind of get into a lot of these categories and be very specific about the types of agencies we're talking about and even go through navigating some of those agencies' websites so we can help you find information. It's all out there, but I know it can be kind of overwhelming to navigate that yourself and maybe not even knowing where to start. That's something early in my career I can certainly relate to that feeling. And so the reason we kind of want to get you to start thinking about kind of like what the breadth of partnerships with your agency could look like is because CoCs don't and also shouldn't have the capacity, resources, or expertise to meet every need. And I say they shouldn't because if we try to be all things to all people, it limits our ability to like be expert or to deliver on what we do really well. To the extent that we can. So for example, I might be excellent at being a shelter provider, but I'm not as well versed in employment and adult education. So I want to build that connection, that bridge, so that when someone comes to me with that need or want, I can easily connect them and to meet the whole person needs. And I'm referring them to the person that has the expertise, and I'm not trying to take all of that on myself or as an agency. That ends up with us being really stretched thin if we try to, like I said, be all things to all people. So what are some ideas of partnerships? Just overview. And some of these you may already partner with, and some you may want to consider. Healthcare, behavioral health providers, substance use treatment, harm reduction services, reentry resources, culturally responsive programming. That's a really good example, one I want to lift up, that, we know that there's disparate impacts in unsheltered homelessness and homelessness among folks who are Black, Brown, and Indigenous. And partnering with those culturally responsive programs can really help us expand our reach and connect with people who may be not receiving our services, or maybe those often are the people who have also been harmed by services as they've been delivered in the past. So kind of, again, building that bridge to engage people that we're not engaging. And then things, outside of the system, like I mentioned, the R&B, transportation, recovery community, benefits, so many different types of those that we'll go into in more depth later. School-based, so community college resources, adult education, domestic violence, sexual assault, dating violence, employment and adult education, child welfare. Another one I want to lift up because nationally, child welfare, unfortunately, is a system that sometimes the gap between that and adult services is a pathway into homelessness. And so how do we partner to prevent that, or to transition people to housing, or whatever the need in your community might be? That's a critical partnership, I think, when it comes to prevention and other poverty alleviation efforts, of which there are many. So again, those are the broad categories that we're thinking about, and we can go to the next slide, where we'll have a poll, and I will ask you, which systems and partner organizations are you working with currently? So we'll give you about a minute to hopefully get your answers in. And again, I would encourage everyone's participation, and then I'll turn it over to Alicia to help me read out some of the responses as they come in.
Looks like we've got one answer so far. We need Jeopardy music while people are typing in their responses.
Alicia, are we sure that folks can enter in the answer? Because on my screen, and maybe that's because I'm one of the presenters, I don't see an option for that.
Yeah, I think that's because you're a host. We've got one answer so far. Just waiting for folks to put in some more. There's two. And these can be very broad categories.
Yes, absolutely. Anyone you're partnering with, I think, in your community adds value to the services that you bring. So yes, even if it's a broad category, we would love to hear kind of the work that you're doing, the good work that you're doing.
We'll give it about 15 more seconds. Okay. That. There we go. Oh, 1 second. You all know Zoom. Of course, I have to log back in before I can read off the answers for you. There we go. All right. So from the answers we've got from folks, we've got Salvation Army, we've got a housing collaborative, a roof above, DV shelters, mental health resources, homelessness services. One person put that they're operating with school-based resources, mental health resources, justice involved, culturally responsive, DV, and child welfare. Got a lot going on there. Another named Frontier House, HHRC, I'm not familiar with that one myself, and then HMIS and the Department of Social Services. So a lot of broad options.
Yes, thank you so much for sharing those. I mean, it sounds like you all already have started this work, which is wonderful. And I'm just hearing a lot of different categories, including faith-based, culturally responsive, youth, educational, all of the above. So I'm thrilled to hear that. And I think later in the presentation, we will get to, like I said, go through some of these options. And I would love for folks to throw in the chat at that point, and I'll remind you again, to guide us to kind of explore some of those things that you have not yet explored, some of those partnerships and resources that we're going to lift up. But before we do that, I'm going to turn it over to Rachel, who is going to talk about resource mapping in your community.
Yeah, thank you so much, Teresa. Just it's great to have folks here from all over the country. I saw that New York is here and North Carolina. We've got Tennessee, we've got Michigan, we got Minnesota. And I apologize if I'm forgetting some of the other places, but thank you all. It looks like there's a big group from North Carolina and so from Charlotte. So welcome you all. It's good to have you here today. So we wanted to talk about resource mapping. What is it and why, right? We've talked about the fact that it's really important to connect with the other systems that may have resources that our own organization doesn't have in order to really effectively serve that whole person. And sometimes it's really hard to know where do we start, right? Like I think we typically know what we offer as an organization, and every homeless service provider organization is different. I think today I saw that we have a community action agency. Would love for other folks to put in the chat the type of organization you are, but we know, right, that there are limits to what we can do, and oftentimes we see that in action in real life. And sort of similar to Teresa, I come to doing this work from having served in the community, both in Portland, Oregon, and in Denver, Colorado, working with folks who were experiencing chronic homelessness. And I had the, I think, privilege of getting to work from within a federally qualified healthcare for homeless clinic that also offered a large portfolio of different kinds of supportive housing. So supportive housing using a housing first orientation, as well as supportive housing that offered recovery and sober living options for people who wanted that for themselves. It was never sort of that people were forced. And so, sometimes we would see that an individual who we were serving had a particular need that needed to be addressed. Maybe it was specialty healthcare. Maybe it was somebody who was needing and wanting medication-assisted treatment because they were wanting to address their addictions through treatment. Sometimes it might be somebody who just simply wanted to be able to reduce their harm, right? And so identifying where in the community could we support that person in finding clean needles, for example. And so, our organizations offer different components. And so it's really important for us to know, well, who does offer these different services, right? And so resource mapping, that's kind of what we call that. It's an activity that your program and its partners can engage in to map out currently available resources and funding streams needed to build that whole person care approach around a person. To effectively map out resources that are needed, successful collaborative partnerships with a variety of agencies must be able to work together. And those of you who put in the chat the list of the different organizations you're working with to access some of those services and resources that you don't provide, that, right? That you have those kind of partnerships, that those agencies are working collaboratively with you to address the needs that your organization doesn't meet for a specific set of individuals. And you also know that there are a variety of agencies that will need to be included in any kind of collaborative partnership. And so the necessary partners will vary and may expand over time based on the goals and target population. And again, because your organization doesn't offer every service needed by your client base, you have to work with those partners in order to build that relationship. And it can take time. And I'm so excited that in session 3, we have 2 organizations that are really going to illustrate for you all how they worked to create these partnerships, sometimes over years, right? This is not like a one and done. These relationships and partnerships and creating memorandums of understanding with organizations, that takes time. It takes relationship. We'll talk a little bit more about a guide that can help you think about that. But next week we have James Ginsburg from Recovery Works, which is in Jefferson County, Colorado. And he's going to be talking about how he was able to create these kinds of whole person care systems with multiple partners, both in rural Colorado, as well as in Jefferson County, which is a suburb of Denver, to serve people who are experiencing homelessness, who have substance use disorders, along with multiple other health-related conditions and needs. And then we're also going to hear from a program in Indiana that is a multi sort of service, community behavioral health, affordable housing, supportive housing operator. And the person who will be presenting will be someone who operates a recovery housing, who saw over a number of years that the recovery housing program on its own could not really meet a large number of needs that its residents had. And so he developed a partnership with this community mental health agency. And again, took years. He's going to talk about what that took, but we're just really excited that not only can we talk to you all about some of the steps of how to do this here today, but you're going to actually hear examples of that, which will probably be a little more interesting than what Teresa and I are sharing today. Or just engaging, I think is what I mean. Okay, so let me move on to this next slide here. So let's see, resource mapping? Yep, okay. So mapping the resources available to address the whole person care needs of a population you're serving can be done using what we call a crosswalking tool. And it's really, I'm going to show you exactly what it looks like in a moment. It's a matrix. So you could create this in an Excel spreadsheet or any other kind of sheet you use that has multiple columns. And you're identifying for each need or each service the following items. So let's pretend that I identify that, well, you know what, we've got our housing case management covered. We have a partnership, or we operate, we may own or have a relationship with a property manager where we're assisting people to become housed, but we don't offer any employment services. And that's a gap, right? So we need to figure out who in this town, who in this city, who in this county offers employment related services, right? And I can tell you from having worked, in the field for a couple of decades that I have forged relationships with your one-stop workforce investment board center. I've forged relationships with the Department of Vocational Rehabilitation Services. So there are a variety of different systems that I want to partner with for that particular type of service. And then we want to also outline, well, what funds that system? So I know that Department of Labor funds the vocational rehabilitation services, administering agency, and then the funding mechanism. Let me show you on this next slide because I think it makes it a little bit clearer. Let's see, I'm going to jump to this slide now. So you can kind of see here that it's laid out. What services provided, what funding source currently is paying for these services. And you can see here's an example. So let's say the service is medication-assisted treatment, right? Okay, what funding source currently pays for medication-assisted treatment? Well, there's this SAMHSA opioid response grant. And then there's also Medicaid in our state. Our state Medicaid plan has determined that it will cover medications to treat opioid use disorder, as well as we qualified for a SAMHSA grant. And then what agency currently offers these services? It's called Recovery Support Connection. That's the name of the program in my community. We could have, 4 different organizations that offer that service in any community. We could have, 1, we could have none, right? We know that a lot of you are from rural areas and you may not have an organization or a clinic that offers medication-assisted treatment in your area. And that will lead to other questions in terms of resource mapping. That next column there, what funding mechanisms are used for this service? So again, I'm listing the State Opioid Response Grant, which is an annual grant. It's good to know as we look at this across our organizations, who's responsible for administering it and how often does that funding source, how long do we have, right? And we can see in this Medicaid 3-year that that's a managed care organization contract that's rebid every 3 years. So we know in 3 years, or maybe we're in the middle of it, we know in 1 year, we're going to have to worry about that organization being qualified to continue to get that funding stream. For what eligible population is the service covered? So here, for this medication-assisted treatment, it's indigent, so that's uninsured or Medicaid-covered adults. And in the next column, in what geographic areas are these services offered? So that could be City of Milwaukee as an example, could be this geographic region, it could be a small town, right? So we just want to identify which geographic area that this particular provider is serving. And then it's really important to have a key point of contact. We know that our workforce is turning over sometimes pretty frequently in any one of these provider organizations. And so this is something we need to update, but it's also something we need to use to train incoming staff. I can remember in Portland where I had a relationship with the Multnomah County Department of Corrections person for 10 years. She contracted with us for reentry, transitional housing. And so I could pick up the phone and just say, hey, Leave, here's a need we have. Do you think you could build this into our contract? Right? Or she could pick up the phone and say, you know what, Rachel, we have this additional kind of specialty population. Could we look at renting out some additional rooms to serve them? But I realize that in 2024, you all may not have colleagues at these different partner agencies that have been there for 10 years. I think the pandemic, impacted longevity. And, we just have new people coming in. So it's important to have that contact information in a central location. I want to go back a slide because this had some additional content. So how to do the mapping. So the services included in the crosswalk may be provided by healthcare agencies, human service agencies, state and local housing agencies, or community partners. So services may target distinct populations such as the following: adults and or families and or youth experiencing homelessness, people with mental health disorders, people with substance use disorders, people with co-occurring disorders, people with physical, intellectual, and or developmental disabilities, people with traumatic brain injuries, older adults, veterans, and other populations needing long-term supports, people who are fleeing domestic violence, right? So it's essential that the team completing this work include members from that wide variety of agencies and programs and organizations. And I want to show you this particular tool, which I'll ask Alicia if she could throw into the chat. Because this is a really helpful document that the Centers for Medicare and Medicaid Services, through its Innovation Accelerator program, published. It talks about partnerships. And I think while it's focused on Medicaid at the state level and housing at the state level, I think there's a lot of valuable content in here as you think about how, if you don't have these partnerships, how do you forge the partnerships? And you can, the part I really kind of wanted to highlight for you all is, and here you'll see some of the same information we've shared today, right? The types of partnerships and common partners. I want to kind of highlight this part, which is some important and necessary components of successful partnerships, because you really cannot underestimate the importance of each of these items as we start to forge partnerships with other systems. So first of all, we need a common understanding of the language and jargon used, the target population served, and goals and intended outcomes of the various systems involved in the partnership work. So it's super important as we're starting to forge these partnerships to really just be clear about, this is what we mean when we say permanent supportive housing. What do you mean when you say you're going to do medication-assisted treatment induction? What does that mean? I don't know what that means. I'm not an alcohol and drug treatment provider. Tell me what that means. What does it look like? And there's all kinds of other jargon, right? We could start talking about Section 8 vouchers or shelter plus care vouchers or rapid rehousing to our healthcare partner at the state or at the housing authority or even with a landlord. Not the housing folks. So you could talk about that with, let's say, your community health clinic, or even sometimes our behavioral health clinics. And they're like, what are you talking about? I don't know what you mean when you say shelter plus care. I don't know what you mean when you say rapid rehousing. So it's very important to spend time orienting all partners to each other's language, as well as the target population that we're talking about. And then it's also important to share in-depth governing policies and operational practices. Sometimes we, as the homeless service provider who may be placing people into housing and have housing navigation, we don't really understand the reason why an alcohol and drug treatment program can't just, offer people clean needles. Why aren't they covering the cost of needle exchange? Or why aren't they simply just administering methadone freely? There are all kinds of regulations and policies that each of our systems have that the other system, when we're talking about bringing the services together, need to understand that full context. And then a genuine openness to input about opportunities for coordination and program and policy changes. This is so important, right? Because I bet any one of you, and I know this is the case for me, and I'm going to guess it's the case for Teresa, have had the experience where there was good intent to forge partnerships with another system. Let's pretend we're trying to support people in accessing their Social Security in a more expedited manner. but the head of the partner that we need to work with, maybe for whatever reason, is somebody who's stuck in their ways. They've been doing this work for 30 years and they're not as familiar with working flexibly in collaboration as we might like them to be. So often, if the good intentions, genuine openness isn't there, that can really stall that collaboration with any partner. And then this fourth bullet down, regular and routine communications shared among partners. That's so key, right? We've got to keep each other up to date on what is happening. You know, I walked away as the supportive housing program with Housing Navigator with a list of things that I needed to look into to forge this partnership. You walked away with your list. Well, we got to talk to each other regularly to see where are we on our list of to-dos and what's getting in the way. And the communication has to be transparent as well. Can't keep some people in the know while we keep other people out. Staffing and financial resources support of the partnership's work is so important, right? Like, we can come up with this great design of a partnership to work with a community mental health center, an alcohol and drug treatment program, a housing operator, and a health clinic. But if we don't have the financial resources to do what it is that we're envisioning, then it's not going to happen, right? If we don't have the staff who can work flexibly to do care coordination across those, it's not going to work. So we need those things in place too. And then finally, leadership buy-in and support of the initiative needed to bring the work to fruition. So again, you need executive leadership at the table who are really invested in creating an effective partnerships that really brings together that whole person system of care. All right, I think I've talked enough about that. I do want to just add back at this crosswalk, this is not like a prescriptive, you do not have to use each of these columns. These are examples of headers that we think that you all should be including in whatever resource map, crosswalk exercise you're doing. I personally would advise adding a few more columns to this. So for example, it's really helpful if I have a column that looks at service capacity, right? I want to know how many people can that alcohol and drug treatment program induct onto medication-assisted treatment, or who can continue to be treated through that clinic at any given time, right? That's super important. Are we talking about 10 people at any given time? Or are we talking about 300 people at any given time? And it's helpful to then, if we have a capacity to on once a month, maybe track, where is the capacity? Is there more room to be making referrals? I think another column that's really helpful is to have one that has a hyperlink to electronic referrals, right? Wouldn't it be great if as we're training up new staff, if this was kind of like the location for all of the information they needed in order to make referrals? There's the person that they're supposed to contact. Here's the electronic link to a referral form with the instructions of where I send the referral form. It's helpful to have hours of operation as another column, intake hours, how long are the services offered for, if that's something that is, there's a limit to, and anything else that you can think of to add here. Really, the sky's the limit. So these are all things that could be helpful as you begin to resource map, if that's something you haven't done before, and crosswalk. So I'm just going to pause there to see if there are any questions before we move on. And please don't hesitate to just, throw something in the chat. Okay. Well, you can ask at any time. So now we're going to talk about the gaps. And I believe, we talked about once the resources are mapped. So now we do have a column on capacity. And we know that, oh gosh, our community only has capacity to offer intensive community-based case management to a total of 50 people at any given time. Okay, so now we're going to look at what are the gaps and what do we need in order. Well, first, we also want to know, are we fully utilizing those 50 units, right? And if we're not, why? What's the problem here? And these will help you identify the additional types of relationships and partnerships that you need to have in order to improve on that. And so we have an example here. Let's pretend your community has 20 mental health crisis respite unit beds, but it's seldom occupied at even 50%. So now we need to find out, well, why is that? What are the barriers? Is there insufficient intake staffing? Maybe they only intake on the third, every other Monday from noon to 2. Like, is that a problem? Do we need to have increased availability for intake? What else? Is there a lack of knowledge how to refer? Maybe it's a secret. There's not that much information in the community about, well, I didn't even know this program existed, much less how do I make a referral to it? So, or is the referral overly burdensome? Because it requires, 6 different pieces of ID, and we know that the folks who we're serving, the frequency with which we find somebody who is unsheltered on the streets, or who's in a shelter, who has their Social Security card, is like 1 in, I don't know, I want to say 50, if it's even that. So these are things that we need to think about in terms of how do we address gaps. And so Teresa says, if you use shared drive or Google Drive in your agency, you can also link to physical forms. Thank you, Teresa. So you have everything you need linked in one place. So it doesn't have to be a referral form that's housed on a referring agency's website. It could be simply that we have a Google Drive where we keep that form and we know how to get to it. Thanks, Teresa. So I hope that is making sense. And now I'm going to pass it back to Teresa, and we'll get to give you some examples of how to locate some of these agencies in your own communities.
Thank you, Rachel. And before we move on to that, I just want to lift up something Rachel said and something that it made me think about, because it really reminded me of the power of the relationships that you're building. And we started this presentation with what's possible in my community. And I think reflecting on some of my work in the relationships that maybe I never foresaw that would be fruitful and helpful and productive, and that the way we were able to get there is through establishing relationships. And just like establishing relationships is important with the people we serve on outreach, it's important with agencies that we partner with that might not be traditional partners. One thing I'm thinking of that Rachel mentioned was substance use treatment. Particularly, this example that's coming to my mind is like inpatient addiction treatment. When you're in a community and there is such a shortage of beds, it's been my experience that unfortunately, for a variety of reasons, people with less resources have less access to those beds. And that can include a lot of the people that we're serving, like the unsheltered folks in our community. And so I don't think this is by design. I think sometimes the people with the most barriers, it's really, or the most challenges, it's easy for maybe that intake person, knowingly or not knowingly, because they're responsible for managing a community and a milieu on a unit, to kind of give the resource to the person who maybe doesn't have as many barriers. So one thing is like knowing what the regulations are, but the other thing is kind of building the intentional relationship with that intake person, being transparent. Rachel mentioned, what good faith can I put in? Can I help this person get X so that they can get to treatment? Can I provide transportation? And really making that connection so that when you you see the pattern of maybe like your folks don't have as much access, you can advocate in a way that someone's going to hear you. And I can't stress the importance of that enough, because I think like in my decade and a half in the field, like that's my biggest takeaway when we're building partnerships. Just like if you have no relationship with the person that you're working with, like you kind of have to meet people where they're at, right? You have to build that trust to say that like, I'm going to gently push back a little bit because I know that like you really do, according to your funder, according to the rules in the state, you really do have to take this person, and they should have equal access to this bed. But if I have no relationship with that person, they're not going to hear that, and they're going to take it as confrontation potentially, and it might kind of damage the referral pathway. But if you have the relationship and you can work through that conversation, you can say, well, here's what I can do also to make this go more smoothly, or like, we'll be ready to take this person back once they complete treatment, whatever. It could look a variety of ways, and I'm only giving one example of a system that might play out in, but really just want to stress the importance of building those partnerships over time, intentionally, relationship building, so you can work through the challenges that arise as you're trying to connect people to whatever resource it is that they need. So I see Rachel have coffee or lunch with a key person at those agencies, get to know them outside of just their work lives. Yeah, exactly. Absolutely. Like maybe they just had a baby, maybe they lost a parent, did they take a vacation? 100%, because you have a lot of value to each other in so many ways, and ultimately you can get on that same page. Like we're all here to support people through the variety of services that we offer, and at the end of the day, like we share that, and we can connect on that and connect on a deeper level and be able to negotiate those conversations. So yeah, I wanted, before I move on and shift away and dig into like what these individual resources that can lead you to different programs that you may want to partner with are, I wanted to talk about that a little bit, because it really made me think about how I've seen things unfold, like partnerships with law enforcement, or a variety of things that I just never thought would happen, or like I never envisioned it that way. But truly, if you're really supporting a whole person, you have to build that ability to really build deep relationships with non-traditional partners, people that meet needs that you can't, in a variety of different ways. So with that, I wanted to kind of get more into detail about how you find the resources available in your state, how you identify who could be a partner in your state, what are those agencies. I think especially when we're talking about communities where there are not a lot of resources, it becomes really important to at least know how to find them. And I think, the resource mapping that Rachel was referring to, and kind of doing all this upfront research, it can feel like a really heavy lift in the beginning, but as someone who's done it, over time, you kind of have to just make little tweaks and little adjustments as things evolve. So let's start with, actually, let me start with a question. We've been on the slide for a few minutes now. Part of what we're going to do is click on a link to help you navigate through some resources where you can find information. But before I kind of go with my agenda, I'm wondering if anyone in the audience is curious about any of these resources and has a particular interest in one, so that we know to focus on that one. And we can go outside of what we had just originally planned to click on and navigate through. So I'll start going through, but I just would encourage you to put something in the chat if there's something you're not familiar with. Harm reduction, we're going to do that one, Shelly, but thank you. I'm glad you brought that up. So yeah, like Sherry did, any that you're not familiar with that you would like to look at, please let me know. All right, so we're going to start with the SAMHSA grant awards by state. I'll also have Rachel open that for me. Okay. And I think we decided that we would go with fiscal year 23 just to make sure that we have complete information. So if you scroll down, you can see a history of awards in different communities. That's more like if you're curious about that. I think the way that in this conversation, the way we're talking about using this resource is identifying folks who are funded in your community that might, in what they're funded with and how they might be potential partners. Does anyone want to call out their state so we can click on it? Or do you want us to choose one? Minnesota. Okay. Let's click on Minnesota. So this screen will show you the overall picture of the funding that Minnesota gets from SAMHSA, discretionary and non-discretionary, total funding, and broken down by category of source. But if you want to find out who's receiving funding and potentially look into partnering with them, you can go to the detail level, which is right under the header right there. So you can see detail view of discretionary or detail view of non-discretionary. And there you go. You have the grant recipients. So that's one of many ways that you can identify people that may be partners in your community. So it looks like Minnesota has quite a few agencies that are funded with a variety of different sources, which is great. I know not every state is going to have that amount of funding or that many folks receiving funding, but this is one way and one resource to find that out. I think we just drilled down to another level of detail here also.
Yeah, this is the discretionary funds, I think.
Okay. Yeah. So you can see either, and I think overall picture is you're just going to see who is funded for what services they might provide, and identify people you may want to reach out to. I think sometimes the other thing this makes me think of as we were going through these resources is like, yes, partnerships. This is one way to identify those partners. It's also a way to identify peers. And I think like not to underestimate the power of like peer learning, reaching out to someone who is also doing this in your state and kind of resource sharing or idea sharing, or like, this is how we've been successful at this, or this is how we've kind of got our reporting requirements streamlined and, made that less of a burden on the agency. I think it's important to connect with folks in all kinds of ways, but it can be really, really helpful to connect with people who are in your state, because you're kind of like under that same state government, same state agency, same constructs, excuse me. Next, we will go to the harm reduction services. If we can just open that one. And a little bit about this, there's a disclaimer, but the disclaimer basically says that North American Syringe Exchange Network is an opt-in network. And so I think the first thing I want to say about that is, if syringe exchange is illegal in your state, you may find that people don't opt in to share that information, but generally, the opt-in aspect allows for better capturing of like grassroots movements. because they can say like, hey, we're doing this, and they don't have to be funded in any type of way. They don't have to have any particular requirements. And there is a lot of that happening in syringe and naloxone exchange. There's a lot of stuff getting distributed by peers. There's a lot of stuff kind of where it's like secondary, or one person is providing a resource to a community depending on the community that you're in. So if you look at the bottom of this website, you can get a lot of information depending on what you're looking for. So you can learn how a syringe exchange operates. So that's 1-to-1, which is you give one, you get one. 1+ is you return some, but you can get more than just what you return back. And needs-based is just, and this is actually the best practice, is people come in, they just ask for what they need and they receive it. Secondary, if you look at the bottom, when we're talking about secondary, we're saying like, okay, so maybe we give them to a peer, or maybe we give them to an organization and they distribute on our behalf. Mobile, I think, if you're going across the bottom, is super helpful, especially if you're in your community where there's not a lot of brick and mortar sites. There are also some sites, and it's not captured here, but you could drill down and go to folks' websites, certainly, where there's mail-based programs. That's a big thing in rural areas. Sometimes even the health department will do that. It really depends on where you are, but a lot of syringe service programs, if they need to expand their reach, will do mail-based programming. And then there's, if it's not a full syringe service program, but they're distributing naloxone, there's also an icon for that. So not only can you see like what's available in your area, but you can get specific if you want to. I guess my thought with that is like, if you're connecting someone to something, like what Rachel lifted up, is like get as much detail as possible so that when you're making that connection, you can prepare them for what the experience is going to be like, and streamline that connection. Definitely want to point out that certainly in different parts of the country, they're a lot more resource rich. So we've got some work to do there, but this is somewhere to start. And also for folks that maybe don't know, aren't as familiar with syringe exchange programming, I say syringe exchange programming, but typically they offer a wide variety of other resources. So we're talking like drug user health, which would be like HIV, STI testing, sometimes treatment, sometimes PEP and PrEP, sometimes Hep C treatment, wound care, safer use supplies other than syringes, certainly naloxone in most all of them, and also overdose prevention, and many now, depending, again, there's state by state, there's different laws. I'm sure you're all aware. Many now are offering testing supplies. So fentanyl test strips, which is critical for folks that use opiates, but a lot more so for folks who are using stimulants, who are not expecting fentanyl to be in their drug supply, since we know the drug supply is really like adulterated at this point. Some have xylazine test strips, and some even have other mechanisms of drug testing to really help people understand what is in their substances and how to make informed choices about their use to reduce their risk of overdose and other illness. I see Alicia, thank you, pointing to a resource that HHRC hosted, a webinar featuring syringe service programs in Oklahoma and Puerto Rico. So it sounds like there's some innovative stuff happening there, and I would encourage you to check that out. I'm just going to scroll up on the chat and see if anyone else have any on this page that they would like to look at and dive into further. If not, I think I just want to point out on this slide the State Office of Rural Health, because I know we have a lot of rural communities on this call. So this is really just a contact list of rural health departments and resources state by state. And we point that out because I think, ideally they have like centralized resource listings of what's available, just in case there are things that you're not aware of in your community. I think, Rachel touched on staff turnover, which is real, and a huge problem in our workforce. And so anything we kind of can look at to get more information about what's available in our communities, especially when we're struggling with resources, I think could be a big asset.
Teresa, can I just ask a question? I know that Sherry from Minnesota earlier was asking us to open a couple tabs, and Sherry, I don't know if the 3 counties that you listed are considered part of in Northwest Minnesota are rural, but I think, for example, like, I don't know whether any of our grantees have capacity to go, like if you're in a rural area, to go to a rural health conference, right? Because you might meet managed care organization folk there, or hospital folks there, or other sort of public health folks who really are have an invested interest in addressing homelessness in those rural areas, because we know that leaving it unaddressed is oftentimes more costly for those systems. And we know from our perspective, it's more deadly, right? So I just pulled up Minnesota here, as you all saw, and noticed, oh, there's this conference on June 17th and 18th. And, would that be something that could be of value to a homeless service provider in attending?
Thank you, Rachel. And sorry that I missed that comment. Yeah, I couldn't agree more. I think peer learning is one of the most powerful things you can kind of arm yourself with. You get to connect with people who have potentially solved some of the problems that you're trying to solve, or made some of the connections you're trying to make. Or maybe if they haven't, then it's an opportunity to think through things together and stay connected. So I appreciate you calling that out. I'm just gonna kind of go through what some of our other recommendations are for places you might locate resources. So Medicaid state plan information, certainly, state housing finance agency, generally, though I know sometimes how updated it is can vary. We'll have listings of like affordable housing resources and locations, often by location. State and regional community action associations. This one we put in particular because when we were doing research for this webinar, we learned that there are community action agencies and associations in almost every community, like more widespread than any of the other things that we're talking about. And they really are kind of able to flexibly meet the needs of the community. Certainly, we all know funding and resources can be a challenge, but wanted to call that one out. Certainly be familiar with your crisis response 988 operators, recovery residences, Oxford houses, which is a specific model, SOAR programs, and the other ones we've touched on. And again, I would encourage you, if there's one you want us to drill down into, please let us know, because we're happy to do that. And I think we have some time to do that today. But if not, we can go to the next slide and we can go back and forth between slides if you think of it later.
Teresa, is it okay if I ask a question? Again, just we love it when you all interact with us. How many folks on this call are familiar with the SOAR program, which is a benefits and acquisition, benefit and entitlement acquisition program that helps expedite people getting onto SSI, DI, and therefore Medicaid in states that don't have Medicaid expansion? Oh, thank you, Alicia, for populating that. And actually, the Homeless and Housing Resource Center contractor, PRA, they also operate, I believe that's right, Alicia, the SOAR Works website and learning. But is it okay if I just open this one? Because I feel like not all homeless service providers are familiar with
Yeah, absolutely.
where they're, yeah.
The more we can dive in today, the better.
So here in North Carolina, because I know we've got a lot of folks from North Carolina on the call today, so I just pulled it up. You can
Rachel,
see.
I'm also happy to give a bit more information about SOAR, just as a
Oh, perfect. That would be great. Thank you.
Yeah, absolutely. So SOAR writ large is a model for doing SSDI applications. There are different SOAR programs in each state. They look a little bit different in each state. North Carolina, I love that we're shouting them out because they have such a fantastic program, and Adriana Diaz, the state team lead there in the state, is very active. She's really trying to build that up within the state. But SOAR is, so on our website there, we offer a 20-hour course that sort of teaches you how to assist somebody with an application, what Social Security Administration is looking for in those applications, what the disability determination services are looking for in those applications, as well as some tips and tricks specifically as it relates to working with people experiencing homelessness. I think all of us have experienced trying to work in services that require a bunch of identification, a bunch of addresses, mailing addresses, living addresses. So it's really geared towards people experiencing homelessness or at risk of homelessness. And we think of those benefits as sort of a stepping stone in achieving other things. I've been talking about this a lot in my SOAR work, but I actually got the opportunity to assist my own mom with an application using the SOAR model last year.
That's so cool.
Yeah, and since doing so, she's been able to achieve a very new level of stability that I love to see recreated in other people's lives. But yeah, it's a way of providing these extra benefits that can help you access other things. We've all worked with folks who don't come to us having any type of income, and maybe who don't have the immediate ability to get back to work. This can be another way to help achieve that income and reach some of those other goals.
Yeah.
And that training is totally free. It comes with 20 CEUs. There's a training for adults and a training for children. And I'll drop the SOAR email address in here as well. I'm happy to connect folks with our liaison to your state to chat further about it.
Thank you, Alicia. It's such important work. I mean, it just, when you think about a lot of the people who are experiencing unsheltered homelessness, who we know have disabling conditions, but they don't have SSI or DI, and all the difference that can make in terms of being able to access housing and services. Sorry, Alicia.
So did you want to navigate that website at all, Rachel, or do you want to move on to the next?
You want to move on to the next one? I had opened it while you were talking. I'm not sure folks could see it, but yeah, should we go on to?
Sure. I guess so. We just have time for questions at the end. And again, with this new list, if there's anyone in particular that you're very interested in, please put that in the chat. We are happy to do a deeper dive in any of these. Certainly healthcare for the homeless clinic directory and providers, I think, is a really important connection to make if you haven't made that. And again, I keep repeating this, but it's just true because we have a national audience. There's so many different kind of levels of resources in different communities. But certainly, like in my work, they were a really critical partner for street medicine, for mobile medicine, for satellite locations. And often they can bill Medicaid, Medicare, so may have the resources to add additional satellite locations as well as other funding sources. So finding out who in your community, sometimes they're, most of the time, I think, if not all the time, they are tied to an FQHC. And so finding out who in that community provides that service and identifying that as a potential partnership, because I just think in my experience, they have, and I can't speak for every healthcare for the homeless agency, but I've worked with several. They are willing to think creatively and flexibly and really are driven to meet the needs of all folks, whether they're sheltered or unsheltered, or even in the transition to housing. Oh, thank you, Rachel. Federally Qualified Health Center is FQHC. I have to catch myself on the jargon sometimes. But I think, like I said, they've been willing to kind of work with you as you're assessing and identifying different needs in your communities. We've had some partner with agencies I worked for, just came and rode along with outreach. And we started the relationship that way and kind of built from there. Many physicians or nurse practitioners are willing to even bridge certain medications for folks. And I'm thinking specifically of like MOUD, which can really be critical for people who are trying to reduce their use or kind of connect with medication and pursue some sort of recovery. So I just think that the possibilities are endless there. And as you can see, Rachel has pulled up the map to identify where some of those providers are. And another organization or group of organizations that I would encourage you to look at and that are sometimes pretty grassroots, so may not have a ton of publicly available information, is recovery community organizations. Those are particularly generally for folks who use substances, though there are certainly peer recovery organizations for folks who have are recovering for folks who have like serious mental illness. So there are like clubhouse models, there are grassroots models. One model we have in Massachusetts is called Wildflower, and they do things like alternatives to suicide groups, really peer-led. Hearing Voices Network, they have a chapter there. So really rich resources for folks who are in recovery from substances, or alternatively, a rich network of resources for folks who are in recovery for SMI or trying to gain some recovery from SMI. And again, the reason I would encourage you to kind of take a deeper dive into this is because they are often grassroots. The website we're navigating now is Peer Recovery Now, and that has a directory of resources by region and by state. And so you can drill down and see who the providers in your area are.
Yeah, Teresa, I'd love to know if any of our North Carolina audience members have seen the names or familiar with these organizations that are currently up on the screen. So maybe in the chat, just like a thumbs up. Yes, I've seen some of these names and I've worked with them, or a thumbs down. Nope, never heard of them. Okay, we don't have to belabor it. But, oh, got one good message here. Oh, great. Jasmine says, yeah, I'm familiar with them in another aspect. Oh, a certified peer support. So I have peer support colleagues. That's wonderful. Such an important workforce that you are a part of, Jasmine.
Thank you, Jasmine. And also, I just took a look myself, and it's North Carolina has quite a bit going on in that space. So that's really wonderful to see, just because I think it's such a important, like, ongoing, sustaining resource for people, kind of as they navigate a building a new life aside from unsheltered homelessness or in housing, and really provides that non-judgmental support network. Let's see. What other ones on this slide do I want to touch on and make sure I'm lifting up? I listed the single state authority for substance use. And I listed this for a variety of reasons. I think one, it tells you, for the most part, it doesn't always get the private organizations, but it gives you anyone that's got state or federal funding. And it's important to know, because I think that private organizations sometimes can make their own rules, but publicly, either federally or state or city funded organizations have an agreed upon kind of criteria. Generally, they have to accept Medicaid, Medicare, and they most of the time have lower barriers than the private sector when we're talking about substance use treatment. So I recommend connecting with these agencies. They're not always partners, though it may help you, because they usually have like a centralized resource directory of who they fund most of the time. And it can help you identify folks in your community who are providing addiction treatment. But it can also, they usually have a lot of their guidance or their regs publicly posted. So if you are noticing that you're struggling to get someone access to treatment at a certain organization, you go to the SSA, they're funding them, and kind of like they're beholden to a certain criteria or admission regulations. It is a way to kind of like gently advocate or push back for people that you're working with to make sure that they have equal access as everyone else in that system does. And SSA, yes, single state authority for substance use. I know that several times when we were developing these slides, we realized that was easily confused with Social Security Administration. So here we're talking about substance use and addiction treatment. And I think lastly on this slide, I just want to call out that there are some available resources from us, the Technical Assistance Collaborative, and from HHRC that are available and free that you can access, that we've linked, so that when you get these slides, everything is a live link. So you can click through to anything that we didn't touch on today, or we didn't do a deeper dive into today, or any of the resources and webinars we've linked. Those will take you directly to that as well. So we can go to the next slide. Unless anyone wants to drop something in the chat that they'd like us to take a look at that we haven't. No? Okay, we can move on. Additional partners. So here kind of we wanted to call out the difference between folks that we typically partner with as COCs, street outreach teams, path teams, shelter operators, affordable housing operators, landlords and housing authorities. I do know that not all COC providers necessarily have formalized relationships with affordable housing operators, landlords, or housing authorities. I would certainly encourage you to forge those relationships. I think certainly, just like we touched upon building relationships in any other context, I've found that if you can build strong relationships with the folks who are reviewing applications and be in close communication, have a memorandum of understanding, or releases of information to communicate on the people you're working with behalf, it can go a long way when we're trying to mitigate some of the factors that keep people from getting into housing. So I'll give an example. When we were rolling out some vouchers, when I was working in the city of Cambridge, we had a really, really strong relationship. So we would be in communication about whether or not someone was denied and the reason for their denial. And though they can't get, sometimes it was quarry related and record related, and though they can't give the specifics of that, they can say that's the overarching reason. And so one thing that we would do is say like, okay, so in this situation, we're going to submit references. We're going to submit letters of support. We're going to submit records showing this person has been engaging in treatment or just has been doing X, Y, and Z in shelter, part of the community, participating. So we could intervene and we could use those efforts to mitigate the fact that they had a quarry, and it would sometimes change the outcome of what happened with their housing application. So those are really critical. To be able to have that open communication prevents kind of like the cycle that we often see, which is we submit housing applications, we get rejected, and it feels like there's nothing we can do, when in fact there may be some avenues we can take. And I think if you build a strong enough relationship, sometimes you can even get advice about like, what are the possibilities of something a person can do to like challenge or appeal these housing decisions. So I'm sure you're all familiar with supported housing, recovery housing, and your rapid rehousing providers in the community, and you may be those providers. But I think we also want to make sure that we're thinking about by us, for us led organizations, community-based organizations serving Black, Brown, and Indigenous or other socially disenfranchised groups, tribal groups, recovery community organizations, and faith-based organizations. We touched on this at the very beginning, but recognizing those disparate impacts of homelessness and unsheltered homelessness, we really want to be intentional about the partnerships that we build to reach the people that we know have been historically left out of planning in the system, who've been harmed by the system and the way that services were delivered. I think it can also help us shift how we deliver services to be more culturally responsive, and build that connection. We can go to the next slide. Healthcare partners, I think we've touched on quite a few of these. So managed care organizations sometimes have housing resources, behavioral health, community health, street medicine, hospitals, public health organizations. They were a huge partner for us in shelter during COVID and came in and vaccinated folks. We can go to the next slide. And lastly, benefits, entitlement, employment, and education supports, child and family services. We already talked to kind of how that can unfortunately, in the current state of things, be a pipeline to homelessness, and how we could potentially partner with folks to avoid that situation. SOAR programs, which Alicia explained really well, Social Security Office, disability determination, a variety of different employment service providers, community action agencies, philanthropy, to kind of supplement the funding that we get to do some of the programming that maybe doesn't fall under traditional categories and kind of gives us more flexible use of funding in some cases. Researchers, motel operators, there's a lot of innovative stuff going along with libraries. I know social workers have been embedded in a lot of libraries around the country, because that's where a lot of folks who don't have elsewhere to go in their community spend part of their day. So there's a lot of innovative social programming happening there, and making that connection can really be a way to maybe find people you're not seeing during the day, or extending the reach of the services, or engaging people. And so with that, I think we have some questions in a poll just to get you kind of thinking about next steps, and I will pass it over to Rachel to do those.
Thank you so much, Alicia. Really appreciate you all spending your late morning, early afternoon, late afternoon with us, whatever time zone you're in right now. So we would love to just ask you all to identify 1, 2, or 3 partners you don't yet work with, that you would most like to develop partnership agreements with over the next year. Really hoping folks just, I mean, this is not like a test, and we're just interested in your takeaways. You thought about, oh my gosh, like why don't I know who that is? why haven't we developed partnerships? So love for you to answer this question, and we'll give it another, say, 20 seconds. And it's okay if you don't know where to start. That's kind of what we're here for. And we'll talk about at the end of this, how if you would like more thought partnership on how to do this, that we're here, and how to request, say, some one-on-one TA time with us. Okay, Alicia, you want to close the poll and read us the answers?
Sure thing. Let's get to that. So we got a couple of responses. One person, I'm assuming from North Carolina, said Sunrise in Asheville was one of their goals to start working on a relationship with. Another one specifically named the public library as well, which is a certain passion project of mine.
Awesome. That's great. So as you think about that, I think we have one more question that we want to ask you all. And this one is, what steps can you take next to develop partnerships with those systems you want and need at the table? I think both Teresa and I suspect Alicia, all started out, right, doing this work on the very front lines. I was an intensive case manager. I was a supported employment specialist in another job. I did crisis response, right? So we all started out, doing this work. And I think over time, likely thought, well, gosh, this work is important. And I also am curious about, how do I address some of the barriers that I see related to the people who I'm working with being able to actually achieve stable housing or income, like to get a job. And so, don't feel shy about, if you're someone on the front line, like, think creatively about, like, well, if somebody made me queen or king for the day and I could wave a magic wand, this is the partnership that I need to have at the table. And this is what I could do. This is the first thing that I can do. So I'm so excited because I see 6 people have answered this, and that's wonderful. Do you want to share the results, Alicia?
Yeah, so we've got using the resources that we've gone over today to develop a better partnership with surrounding agencies. Love that one. I know for me, having done street outreach, that crosswalk would have been a really valuable resource in my first couple months. Reaching out and making contact, explaining who we are and who we serve. Excellent first step. Connect and build relationships with different organizations, doing more research to see what's available in that area. I think that's a really great callback to that crosswalk. Reaching out and doing introductions, finding the common ground to start conversations, absolutely. And then our last one is researching the services offered by a potential partner agency, emailing, introduce yourself and the organization, talking about your possible partnership and making those opportunities happen.
Yay, you guys.
Yes, thank you, Alicia. I think what sticks out to me and what I was going to say is that, like, sometimes those first steps are just identifying, compiling, and reaching out, and like that is what starts that path forward. So thank you for those responses.
Yeah, and I mentioned a little bit before the polls, like, we are here, Teresa, myself, we have lots of wonderful colleagues who've also done this work on the front lines over the years. We're here to support you. And I think Alicia put in the chat the hyperlink to this submit a question. So if you want to have a call with us, you want to send us something to react to, if you need some more thinking about, like, but how would I start that? Please do not hesitate to submit a question to the Homeless and Housing Resource Center. And if you go to that link, you'll see that in the subject line section of the contact us form, make sure you're selecting HUD SNOFO grantee TA questions, because the center does a lot of TA for different projects. And this project that we are working on right now is the special NOFO grantee TA question. But if by some means you forget to do that, you know, just throw our names in there. You can say Rachel and Teresa, or you can say TAC, whatever. You know, we are here to support you all and help you all think through how you might begin to kind of build those relationships, or even just identify what gaps you have. So, yeah, so I think that is it for us. And I know that the Homeless and Housing Resource Center, they always want to evaluate how effective their trainings are. And so we really hope that, and there's also a certificate for participation that you'll get if you fill out this evaluation form. If you don't need a certificate, just fill it out anyway, so that Teresa and I have feedback and we know how to do better next time. And you know, with that said, I hope that you all will come next week at this time and hear from these incredible organizations that have built these partnerships over many years. You know, we're going to ask them questions about what was the biggest challenge? How did you know where to start? You know, what convinced this or that organization to come to the table with you and to share their resources? So I think it'll be really, really informative. And I'm just looking in the chat if there, oh no, I see that. Thank you, Alicia. She put the certificate for attending in the chat. And is that also the link for the evaluation? Yeah, perfect. Excellent. Oh, we are over. I am so sorry. Thank you all.